at the doctor. Long English listening and speaking practice. Welcome to another immersive English learning experience. In today's lesson, we're diving into one of the most common but often stressful real-life situations, visiting the doctor. Whether you're traveling abroad, living in an English-speaking country, or just trying to improve your practical English, this video will help you master health-related vocabulary and learn how to communicate confidently with medical professionals. You'll hear tricky terms like diagnosis, the identification of an illness, prescription, written advice for medicine, inflammation, swelling or irritation, gastrointestinal, related to stomach and intestines, respiratory infection, a disease affecting the lungs and airways, migraine, a severe headache, often with nausea or sensitivity to light. We'll also cover real-life dialogues at the clinic, with doctors, at the pharmacy, and during a follow-up visit. Ready to become fluent in medical English? Let's begin. Scene 1. Arrival at the clinic. Good morning. Welcome to Riverside Clinic. How can I help you? Hi, I haven't been feeling well, and I'd like to see a doctor, please. Certainly. Do you have an appointment? No, it's a walk-in. I've been feeling worse since this morning. That's okay. Please fill out this form with your name, date of birth, and describe your symptoms briefly. All right, thank you. Scene 2, inside the doctor's office. Doctor, hello, Emma, I'm Dr. Reynolds. That's what seems to be the problem today. Hi, doctor. I've had a sore throat and low fever for about 3 days. Today I woke up with body aches and a pounding headache. Any cough or shortness of breath? Yes, a dry cough started yesterday. It's not constant, but it's bothering me. How about chest tightness, fatigue, or dizziness? Some tightness when I breathe deeply. I've also been feeling very tired, but no dizziness. Sounds like it could be a respiratory infection. Have you traveled recently or come into contact with anyone who is sick? No recent travel, but one of my coworkers had a cold last week. Scene 3. Medical examination. All right, let's check your temperature. 38.5 degrees Celsius. That's a mild fever. Now let's listen to your chest. Please breathe in and out again. Your lungs sound a bit congested. No signs of pneumonia, but let me check your throat and lymph nodes. Okay. Say, ah. Your throat is inflamed and your lymph nodes are slightly swollen. So, what do you think it is? Most likely a viral upper respiratory infection, common during seasonal changes. It should improve with rest and fluids. If it turns out to be bacterial, we might need to prescribe antibiotics. Scene 4, vocabulary spotlight. Let's take a moment to review some key medical terms you just heard. Term. Meaning, inflamed, red, swollen, and possibly painful. Congested, blocked with fluid. Lymph nodes, small glands that swell during infections. Upper respiratory infection, infection in nose, throat, or airways. Antibiotics, medicine that fights bacteria, not viruses. Scene 5, discussing treatment. Should I take any medicine right now? I'll prescribe paracetamol for fever and body aches and lozenges for your throat. I'll also give you a cough suppressant. Drink plenty of fluids and get rest. Got it. Should I stay home from work? Yes. Take at least 2 days off to rest and avoid spreading the infection. Thanks, doctor. Should I come back if I don't feel better? Definitely. If your fever goes above 39 degrees Celsius, you have trouble breathing, or if symptoms worsen, come back immediately. Scene 6. At the pharmacy. Hello. How can I help? Hi, I have a prescription from Dr. Reynolds. Let's take a look. All right, here's your cough syrup, lozenges, and paracetamol. Take the syrup twice a day after meals. The lozenges can be taken as needed, up to 4 per day. Any side effects? The syrup might make you drowsy. Avoid driving or operating machinery. Thanks for the advice. Scene 7, follow-up appointment. Hi, Emma. You're back. How are you feeling? Much better, thanks. No fever, and the cough has almost disappeared. That's great. Your body responded well to the treatment. No need for antibiotics. Thank you so much, doctor. I appreciate your help. You're welcome. Continue resting for a couple more days and call us if anything changes. Bonus dialogue, discussing a chronic issue. Doctor, I've been having frequent stomach pain and bloating. Is the pain sharp or dull? Mostly dull, but it comes and goes. Sometimes after meals. Any nausea, vomiting, or change in bowel movements? Yes, occasionally I feel nauseous and I've had some constipation. You might be dealing with gastrointestinal inflammation or even irritable bowel syndrome, IBS. I'll recommend an ultrasound and some blood tests. Could it be serious? We'll rule out any serious conditions. But IBS is common and manageable with diet changes. Vocabulary recap and practice tips. Let's recap more medical vocabulary from this lesson. Fatigue, extreme tiredness, the feeling of needing to vomit, gastrointestinal, related to the stomach and intestines, chronic condition, long-term illness, diagnosis, when a doctor identifies the disease, prescription, written instruction for medicine, side effects, unwanted effects of a medication, over-the-counter medicine, drugs you can buy without a prescription. Now, it's your turn to practice. Try shadowing the dialogues. Speak along with both the patient and the doctor. Use a mirror or record yourself. The more you practice, the more fluent and confident you'll become. Visiting the doctor can be stressful, but with the right vocabulary and speaking skills, you'll handle it like a pro. We hope this lesson helped you improve your medical English, practice your listening skills, and feel more confident using English in health-related situations.